turn to this now. The Gauteng Health MEC, Nomathemba Mokgethi, insists the province has the capacity to cope with the increasing number of hospitalizations due to COVID-19. The province is currently the epicenter of the country's third wave. In the past 24 hours, Gauteng has recorded over 8,500 new cases, its highest daily number yet. The 7-day average is just as concerning at nearly 7,000 cases. 5,000 people have been hospitalized, and there are reports that beds are running out. Let's discuss this further with Bongani Mazibuko, Nursing Union Denosa's Gauteng Secretary. Bongani, thank you for joining me and having this conversation with us. It's one thing for those of us who are on the outside to, give commentary on the situation and how dire the situation is in Gauteng in as far as the test positivity rate is concerned, but also the hospitalizations of people in Gauteng. Your members are at the front line of this situation in the epicenter of the third wave in the country. What are they telling you about what situations they are facing?
Thank you for the opportunity. Thanks for having us. It's actually a dire situation that we're facing as a province at the moment. We know for a fact that in the private sector, the hospitals are almost at capacity, and we also know that in the public sector, there's a number of institutions that they've had to change other wards into COVID wards because there isn't enough wards for the COVID patients. And most of all as well, we know that there's a shortage of nurses or personnel to deal with these new cases that we've got a surge of. And if this were not true, we'd be having the Carletonville Hospital being fully functional. We are having a shortage of nurses, and that is just the reality of it as a country.
How does this shortage of nurses manifest? And has it been exacerbated by the demands of the COVID-19 pandemic, the fact that, nurses and other healthcare workers have been going constantly since the outbreak began in March last year? Or is this more systematic? Is this more about, generally as a country, we've faced a shortage of healthcare workers?
The shortage of healthcare workers is there, but it has been exacerbated by the presence of COVID in the country and the way we've been trying to deal with it. If you look at it, particularly from a nursing perspective, we've had lesser and lesser numbers of nurses being produced by the country, and that is what has led us to where we are. And furthermore, we've got a government department, particularly in Gauteng, which is always problematic in having to employ or appoint nurses immediately after they finish their community service. Now, how do you train people because you need them, and then at the end of the day, you are unable to give them employment? And those people are roaming around not having any work. So now, if we were to go and reach out to those nurses that are looking for employment, it might assist a lot in curbing the current shortage of the nursing staff.
I hear you say that if we had enough nurses and other healthcare workers, we wouldn't have Carletonville Hospital. We would have Carletonville Hospital operating optimally. Is it your information that it's not operating optimally at the moment, and this is due to a shortage of nurses?
The Anglo-Ashanti Hospital, the Carletonville Hospital is operating, and they're also facing their own challenges. But we would need to have the Anglo-Ashanti Hospital being open and functional as well. Because even that is one of the reasons why I'm assuming that the acting Minister of Health would have wanted to deploy the SANDF military health services to the province, because she knows that there is a shortage of nursing personnel and medical healthcare workers in the province.
So the nurses and healthcare workers and other healthcare workers are the software of this equation. What about the hardware? One of the stories we've been talking about and focusing on is basically the hospital infrastructure in Gauteng that seems to be buckling. What with the field hospital at Nasrec having been shut down and not operational, but also you have one of the biggest hospitals in the country, Charlotte Maxeke, out of commission at the moment. What are your members telling you about the impact of some of those challenges in them doing their jobs and responding to this pandemic?
They're having a great deal of difficulty. I think we even raised it last week to say that Charlotte Maxeke, when we had Charlotte Maxeke being operational, we had the field hospital in Nasrec also open. And now that we've got Charlotte Maxeke not being operational because of challenges that are known, we are not opening the field hospital. It doesn't make sense. We should have been at least having that field hospital being open. There's been an overburden of patients to Rahima Musa, Helen Joseph, Chris Hani Baragwana, just to name a few. Not to mention Bethato and so forth. But there's an overburden and the surge of the current patients with COVID-19 is not helping the situation. It is actually making matters even worse.
Lastly, Bongani, the question of vaccination. We're now talking about, moving to vaccinating people in the education sector, some 300,000. In fact, the president talks about 500,000 people being targeted in the basic education sector. How far are we from having all your members in the health sector vaccinated? And does that process continue to have the steam and momentum that it had before we started the other phases of the vaccination, or have we taken the foot off the pedal a bit on it?
We've definitely taken the foot off the pedal because we still have healthcare workers outstanding. And what's concerning with this mass rollout now to say that we are going to be vaccinating teachers and other categories is that we are not employing more nurses. These nurses that are supposed to be doing these vaccine programs are the same nurses that are supposed to be offering clinical care and operating in the hospitals and in the clinics. So it's very interesting to say that we are rolling out and we are looking to vaccinate 500,000 people and so forth. But where is the personnel to do all of that coming from? It's a really strange, I'm not sure, plan. But we need to get the people on board and then probably need to start trimming services to say that some of our services would be restricted so that we can prioritize the vaccine program. I'm not sure, but something needs to be done in that area.
Yeah, absolutely. Solutions are needed. Thank you for that. That is Bongani Mazibuko, who is the Gauteng Secretary of the Nursing Union, Denosa, talking to us about the reality on the ground as Gauteng is firmly in the throes of a third wave, a surge that's quite significant in the last few days, last few weeks in the province of Gauteng, which is really the epicenter of the third wave in this country.